Hi everyone, I'm Ken Kozel, President and CEO for Shore Regional Health. Thanks for watching today's video. And if you'll recall last month's video, I ended by talking about Heart Month. And with Heart Month, we were talking about awareness and education that we provide our community to keep a healthy heart. Today I want to focus on very specific cardiology programs and services that have really elevated our game here at Shore Regional Health. And in large part, it started with the creation of our new cath lab, the second cath lab here at Shore, that we opened back in May of 2017. With that second cath lab, we have expanded two very key service lines within our cardiology service division. Under the leadership of Dr. Ben Remo, our electrophysiology services are now a cornerstone of the services that we offer here at Shore. Patients no longer have to travel long distances for life-saving care, and the medications that they take could be reduced with these services, as well as the side effects associated with their conditions. Under the leadership of Dr. Jeffrey Etherton, our percutaneous coronary intervention program, or PCI, has really flourished over the last year or so. And I'm so pleased to announce that we recently received our Cardiac Interventional Center designation, or CIC. That's part of now the cardiac care that we provide here at Shore. This is an incredible advancement for us because CIC designation, provided to us by MIMS, allows our emergency medical services personnel to bring patients with STEMIs directly to our Easton facility. STEMI stands for ST elevated myocardial infarction, and it's when those patients have blockages in their vessels that need immediate cardiac care. Before now, they were taken to Anne Arundel, Peninsula, or even Delaware and Baltimore for their care. But with our CIC designation, our local community can now come to Easton for high-level cardiac care. So all of these services combined really show that we're raising the bar for cardiac care here in Easton and in the Midshore region. And it ties right back to our vision of being the region's leader in patient-centered healthcare. If you live in our community, we want to provide the services here so that you stay in our community for high-level care. Since we've received the designation only a few days ago, we've already had a handful of patients who have received PCI through our Cardiac Interventional Center designation, because I've been told directly by our interventional cardiologists that these patients may not have made it without care being provided here in Easton. So the growth of these programs is in large part because of the leadership of Drs. Remo and Etherton. But I also want to acknowledge Dr. Gabriel Sardi, our second interventional cardiologist, who supports our high-level cardiac care that we provide here at Shore. In addition to our physician complement, there is one key leader within our organization who has had a passion for getting us to CIC designation. That leader, our Director for Cardiovascular and Pulmonary Services, is Mr. Gary Jones. All of us who know Gary know that he is a lifelong Shore Regional Health team member, community member, and strong advocate for high-level cardiac care in our region. Thank you, Gary, for all you've done to help make this happen. And knowing Gary the way I do, he'll want to make sure I acknowledge the team around him and our physicians who provide exemplary care. The nurses and techs in the cardiology service line that answer the call 24/7, 365 for these emergent patients are doing a fantastic job of ensuring that we provide great care. Thank you, nurses, techs, and team members in the cardiology program for all you do. And also for the support staff who accept those patients once the procedures are completed. The nurses in our ICUs and on our telefloors who accept those patients once the procedures are done. Thank you for extending the care to ensure a smooth and easy transition and discharge. Services like these enable us to make our communities healthier places to live, one patient, and in this case, one heart at a time. Until next time, take good care.